Right, so a limbo in terms of COVID-19 regulations is looming. At midnight tonight, those regulations expire. There was legally a month-long extension of the National State of Disaster regulations. That expires at midnight, while at the same time the Health Department is yet to publish its new regulations. Those have been subject to public comment, not yet finalized as far as we know. Let's discuss. We're joined by Professor Mosa Moshabela, Deputy Vice-Chancellor of Research and Innovation at the University of KwaZulu-Natal. Professor, thanks for being with us as always. So this means technically, well, in fact, tomorrow we don't have to wear masks. There's no legal tool for government to enforce any sort of regulations. Do you agree?
Good afternoon, Francis, and to the viewers as well. I think that this is something that we have highlighted several times when people called for the ending of disaster, that there's a need for a framework to be able to regulate the public health measures and social measures that we need in order to control the spread of infections and generally COVID-19. I think from where I stand, I think it will be irresponsible given the fact that we have a rise in infections and there's still only 50% adults vaccinated. The risk for COVID-19 is still quite high. The risk for spread is quite high. The risk for people with risk factors to be infected is quite high. So it would be irresponsible for government not to extend some sort of legislation in order to ensure that we can govern the use of public health and social measures to protect people.
There are health measures proposed by the Health Department, but there have been a lot of a lot of dissenting comments around those, a lot of wrangling about the public comment. Will government take that seriously? So I guess the Health Department is stuck. Legally, it is obliged to look through all those comments and ponder on them.
Yeah, so the regulations that we've had so far have been very much specific around COVID-19. And the proposed regulations to amend the National Health Act are more about notifiable medical conditions in general, and there are many, and COVID-19 is one of them. So I think that the time that government has had, Ministry of Health has had to review the 300,000 plus comments within the 12 days that they've had may not be enough to review all of them. So it's probably necessary that they do a good job and a transparent job of reviewing those comments and indicating which ones they need to be considered and changed before we can actually finalize what they're proposing. Yeah. So there is a need for some sort of interim measure from their side.
Well, can there be any interim measure? There is no legal tool now unless a government reintroduces the state of disaster or gazettes those health department regulations by midnight tonight.
Yeah, so I think that if they gazette those regulations that are proposed that have just been reviewed for comments by tonight, that would be detrimental. That would be really unfortunate because we live, as we indicate, in a state of mistrust, and there is a need for a little bit more of a thorough process to ensure that the review is completed and government, Ministry of Health can demonstrate how that is done. So indeed, I think what government is going to find itself right now is in limbo, and we are all waiting to see what steps would be taken because essentially allowing the regulations to lapse is not something that is going to be acceptable from a public health perspective. You know, individuals might say that they don't care, the people are not adhering and so forth, but I think it is the responsibility of the state to ensure that the systems and the measures and the legal framework is in place to protect the population, regardless of the attitude of the political parties, regardless of the attitude of small noisy groups in small corners, or whoever is the loudest in the room. What is important is that most people need to be protected, and there's a need for that legal framework to protect people.
Professor, may I challenge you on that? Because the numbers are going up, but we've seen that the death rate remains extremely low. So it seems like there is this decoupling. It's not as fatal, the Omicron variant. There may be more fatal variants in future. But for now, we were always heading to a place where we would live with COVID-19. Isn't that time now when almost nobody is dying, in fact, from this disease?
So first thing, Francis, is that there is no medical condition that can be taken care of without the legal framework to take care of. That is something that we just have to know, regardless of conditions that we have always known, hypertension, diabetes, and so forth. That whole practice needs to have the legal framework to allow it to be implemented. In this case, we have seen the shortcomings of our legislation in terms of caring for people in the event of outbreaks and pandemics, and we need to close that loop, whether it's COVID-19 or something in the future. Thirdly, I think we don't necessarily only care for people when the outcome is death. If we were using that, then it means that a lot of disability that comes from many conditions that people suffer, we would ignore, and we cannot afford to do that. I think that even with COVID-19, we really appreciate that the numbers are not as high. We appreciate that hospitalization levels are not as high yet, but we don't know what's going to happen next week. It's unpredictable. We don't know what's going to happen in 2 weeks' time. And we need to make sure that we are prepared. And lastly, I just want to say that from where I stand, I think that other problems that arise from infections, irrespective of the fact that the numbers of testing are low, the problems such as long COVID and co-infections with other infections are so important for us to look at and monitor instead of just looking at hospitalizations and death.
Professor, you said that noisy groups were raising concern. I'd love to know what you think of the regulations. It basically allows the minister to reintroduce level 1 restrictions. I think the permanency is the problem there. And then for notifiable diseases, which doesn't only include COVID-19, he can implement mandatory vaccines, state quarantines, and things like that. Do you believe that a Minister of Health should have these sorts of powers?
The Minister of Health had it with TB, tuberculosis, and people accepted it. We lobbied very hard for drug-resistant TB regulations to be relaxed a little bit so that people can be cared closer to their homes. But there were times where patients were collected in their homes by the police in a police van. There were times when people were detained in hospital facilities because of drug-resistant tuberculosis. The Minister of Health has a lot of powers to protect the public, and it rightly so. So I don't necessarily think that the powers themselves are a problem. I think that in terms of the dissent that may be coming from certain corners, it may be justified in their own way, but if the question really is whether the minister can use those powers in a responsible manner, that is something that needs to be discussed. But to render the minister powerless completely to protect South Africans, I don't think that that is a responsible thing to do. Yes, right now we live in a place of mistrust, but we trust these people with the power that they have, that they will exercise it in the interest of most South Africans, not only the few voices. That's what a democracy is, not only in the interest of the few voices that may be the loudest in the room.
All right, finally, Professor, on a different note, we know that many of the vaccines we imported are about to expire. And now Johnson & Johnson, the vaccines being produced at Aspen is saying it's going to stop producing unless there's a flood of orders because it's no longer viable. Have we completely failed as South Africa in the vaccine communication project?
Yeah, that's a deep question, Francis. I am not of the opinion that we have failed, but I think that we have stagnated in terms of the vaccine. I think the progress to reach 50% of adults in South Africa is not something that I would have guessed back in late 2020 or even beginning 2021. We've come a long way. I see that progress, and I think it's worth recognizing. I also think that we are in a very difficult climate in terms of politics, in terms of, as we said, issues of trust and so forth, and the goodwill of society. I don't necessarily think that I expected everyone to be vaccinated in South Africa, but I was optimistic that we could reach somewhere close to 80%, and we did not. So in that sense, we did not reach the targets that we aimed for. And I think that it is a failure of our strategies. We could have done better. It is a failure of us arresting misinformation and disinformation campaigns, which were not just in South Africa, but they were global, even in America and other places. So I do think that in a way, we should have done better, and we could have done better, but we did not get to the point that we would have liked, although we must recognize the progress that we made today.
All right, thank you for your analysis. So that limbo looming, we will be speaking to Aspen a little bit later on in this hour. That was Professor Mosa Moshabela, Deputy Vice-Chancellor at the University of KwaZulu-Natal.